Today's topic is anesthesia. Anesthesia is induced temporary loss of sensation that is for medical purposes. That's called anesthesia. In anesthesia we have to know these following points, that is 10 golden rules. Second one is pre-medication before general anesthesia. Third one is dosage. Fourth one is stages. Fifth one is types of or classification of anesthesia. At last, examples of anesthesia. CNS is deprived in general anesthesia and nerve conduction will be hampered in local or regional anesthesia. General anesthesia is of two types, intravenous or inhalational, that is general anesthesia. Local anesthesia is of four types, surface anesthesia, nerve anesthesia and infiltration. Fourth one is field block. Regional anesthesia is of, it can be spinal anesthesia, that is subarachnoid blockage. If injection is infiltrated in subarachnoid space, that is subarachnoid blockage. If around the dural space anesthesia is infiltrated, that is epidural anesthesia. Third one is peripheral nerve block. These are the 10 golden rules of anesthesia. anesthesia. A stands for assessment. Assessment is done by the Malampatti grading, and second one is ASA grading. Second one stands for NBM. Patient should be nil by mouth. And third one is equipments or drug, that is pre-medication required. That is anesthetic drug, or it can be sedative, midas or glycopyrrolate or succinylcholine. S stands for suction. T stands for table. H for hemodynamically stable. Patient should be hemodynamically stable. E stands for evaluate vital signs. S stands for somebody for help. I stand for intubation and A for airway clear. These are 10 golden rules. Further, general anesthesia, in which CNS become suppressed. It can be of two types, intravenous and inhalationals. Inhalational में क्या required है, nitrous oxide, that is carrier gas, और xenon can be used. IV के types क्या हैं? IV is of two types, opioids and non-opioids. In opioids we can use morphine or remifentanil, sufentanil. Remifentanil mainly used in labor. Non-opioids examples thiopentin, that used in narcoanalysis. Second one is etomidate, that used in mainly CVS stable patient. Third one is ketamine, that used in shock and asthma patient. Fourth one is propofol, that is TIVA, total intravenous anesthesia, means for induction and maintenance we can use propofol. In combined we can use, for induction we can use inhalational anesthesia, and for maintenance we can use IV. Examples of inhalational anesthesia will be halothane, that is hepatotoxic, not used in general practice. Other example are isoflurane, isoflurane, sevoflurane and desflurane. Sevoflurane is sweet in taste, that used in mainly in seizures. Desflurane is fast acting. Pre-medication required for before general anesthesia is anticholinergic drug, that is glycopyrrolate 0.2 mg. Second pre-medication drug is muscle relaxant, that is helpful in intubation, and anticholinergic drug will prevent aspiration, means deprivate the secretion and in muscle relaxant succinylcholine will used. that is 2 mg per kg body weight. For sedative we use midas 0.1 mg per kg. These are the stages of general anesthesia. First stage is stage of analgesia. There will be total till loss of consciousness. Second stage is stage of excitement. Third stage is stage of surgical anesthesia. And fourth stage is stage of overdose. Then regional anesthesia, that is spinal anesthesia. It is of two types, epidural and subarachnoid blockage. Through puncturing we first penetrate the skin, after that fat, after that supraspinatus ligament, after that interspinatus ligament, after that we will come across ligamentum flavanum. Between ligamentum flavanum and durameter there is epidural space. Here we will inject, then it goes under epidural blockage. If anesthesia infiltrated in subarachnoid space, then it is called subarachnoid blockage. Epi means outside the durameter, epidural. Here CSF will be present, that is subarachnoid blockage. Here 0.5% bupivacaine will be used. Local anesthesia can be of four types, that is surface anesthesia infiltration, that is nerve block and the field block. Dosage of local anesthesia is, if it is 2% and with adrenaline, with ADR, then 7 mg per kg body weight के हिसाब से body weight into 7 divided by 20. This will be the highest dose that we can infiltrate it before surgery. If anesthesia is without ADR or it is 1%, then patient body weight multiply by 3 divided by 10. This will, we can easily find out the dosage of the local anesthesia. Fourth one is peripheral nerve block. It can be of different method can be performed, that is single injection nerve block, continuous nerve block or ultrasound guided nerve block. Nerve being blocked in as example brachial plexus. Second example is femoral nerve. From here we can justify the peripheral nerve block. This is the 0.5% bupivacaine, that is plain means without ADR, local anesthesia. These are the stages of GA we already discussed.